Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine Procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Bermel.
Good afternoon, and thank you for joining us for American Medicine Today. I'm Kimberly Bermel, joined by our executive radio producer, Ethan Euchre.
How's it going?
Very good. And across from me, I have world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Thank you for being here, sir.
Hi.
A man of few words.
He is.
He is.
So humble. Just to give you some insight about Dr. Bonati, he started off in invasive open back surgery when it first started, and he went to, Wake Forest University. And
Demon Deacons, huh? Doc, you went to Wake Forest? I didn't know that.
Mm-hmm.
Yeah.
Very cool.
Well, he went through that training and, total textbook training. And when he went to actually perform the surgeries, they realized that there were some problems with that procedure, and it wasn't always correcting what it needed to for the patient. Mm-hmm. So with that in mind, he set out to try to develop ways to make back surgery better. And what he ended up doing was formulating the Bonati Spine Procedures. It took him a while, but he not only developed the procedures, but the tools to exactly pinpoint the problem and relieve pain for thousands of people.
Dr. Bonati is one of those guys, as long as I've known him, and we're coming up on a year that I've known him, he's one of those guys in just every aspect of his life.
Yes.
He thinks big. He has vision.
Yes.
And, if he sees a problem, he can fix it.
Yes.
And that's exactly what he did with the industry and revolutionized the whole industry. Why are you looking at me like that?
Of spine surgery forever.
It's true, Doc. Take a compliment.
He gets embarrassed, and
I
he's
know.
one to never pat himself on the back. And actually, that can almost be to his detriment, because I have seen firsthand the multitude of patients that he has helped.
Mm-hmm.
Some wheelchair bound, and then they're able to walk out. People come in with leg braces, and they, of course, leave without them. So amazing things happen at the Bonati Spine Institute with those exclusive Bonati Spine procedures.
Yeah. Week after week, we talked to patients
Yes.
that, they didn't have a lot of hope. They were told by other doctors, other quote-unquote experts, that
Yes.
there was nothing that could be done, that they would just basically have to exist in pain for the rest of their life. Here's some pills, have a pain-filled life. And then they sought out Dr. Bonati and the Bonati Spine Institute, and the guy he literally works miracles and can, how do you say it? Well, it's our Back to Life segment,
Yes.
but you always say continued pain-free existence, because,
Yes.
these people, they had no hope, and then just to go from that to, a normal life once again is pretty amazing.
Yes. Well, on today's show, we're going to hear from a medical expert, Dr. James Pinkney from Diamond Physicians, about how to curb youth sports injuries, which is pertinent because school's back in session. And then we're going to hear about what's new in American medicine today. But up first...
In today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
Well, I would like to welcome to the program Angelo Sapia. He is on the phone from Pennsylvania, so thank you for being here to join us today.
Thank you.
Well, Angelo, you have a fascinating story, so why don't you kind of talk about how you came to be in pain?
Oh, how I came to be in pain when I was very young, very young, I think, 26, and I was working on a chair, and I was rewebbing a lawn chair, and I happened to be underneath of an air conditioner, a big monster air conditioner. And I stood up while under it, and it caught me right at the L5S1 and simply induced a spondylolisthesis.
For the layperson, break down what that means. Where it's the lower back, correct?
You broke apart you broke your facets, I believe, and it separates your spine, so you're really not connected anymore.
So what happened as soon as that happened, Angelo? You stood up, caught your back on an AC unit. I mean, did it
and then
drop you to the ground?
I whited out or blacked out, whatever you want to call it.
Right.
And but I didn't think I just thought I cut myself because I had a nice cut too.
Right.
And so as as time went on and I went back to work, I noticed that I felt like my chest was falling off of my hips. And I actually said that to a couple doctors.
Right.
And after I went to about 10 of them, all of them unable to find it, I came across a guy named Dr. Filtzer. And he was in Baltimore, and he made me twist like a pretzel for about 30 different x-rays, and he actually figured out what it was, put me in the hospital. Then he wanted to give me a fusion, wanted to cut the edges of my hips off, connect them to the top of my hips, and run it to above the break.
What?
An A-frame, basically.
How is that? How is that supposed to fix your issue?
Well, because he would have fused all those together, and it would have worked sort of, I guess, but I didn't like the point of losing my hips. Number one,
Right.
They brought a jockey. They showed me a jockey while I was in the hospital, and as soon as I saw him at the door, he was a string bean, basically. He had no hips, and being 18 years old, I was really. That didn't go over well in my mind.
I'm sure.
I mean, being 26 years old, I didn't go over well in my mind. I was a beach kind of guy. I go. My family goes to the beach, and I live at the beach and work at the beach, and did all that. And I just thought I'll never have another woman the rest of my life if I look like that.
And you definitely don't want to feel like that when you're in your early 20s, for sure.
Well, that's what I'm saying. So that really. So I told him no. So he built me a brace. And I used that, and I did a lot of crunches over my life. I used to do my 100 a day to keep myself in shape. I basically had a 12-pack most of my life. I had to. There was no other way for me to keep myself together. But when I got around 40 years old or so, I could do 1,000 of those crunches, and it didn't seem to matter anymore. My muscles weren't what they used to be.
Right.
So I looked for a solution, something other than something barbaric.
Right.
And I found these cages to screw in, and I had that all set up. I was going to go to California to see a Dr. Black, and my wife had just happened to fall down and hurt her knee, so she had to get her meniscus repaired. And while we went to that hospital to do so, she's a nurse and works there, incidentally. And she said, "You should ask this doctor about your back." And I asked him, and I told him what I was going to do with the cages in California. And he said, "Why are you going to California?" He says, "The guy that invented the cages is here at St. Joe Hospital." He says, "Named Paul McAfee." And I said, "Really?" So he said, so I canceled my operation, and I went to see Paul McAfee, and he said, "Oh, well, those cages are a great thing. Those are a great thing." He says from L4 and up, it's a 98% success rate, and that's what I had read. That's why I was there. He said, "I also did the clinical trials. I also did the clinical failures." And he says, and anywhere from L4 and down, he said it seemed to be about a 90% failure rate.
Wow.
He said, "You don't want that surgery." So I was flabbergasted. So I said to him, "Well, what do I want?" And then he barreled out this little spine that was all bolted together and said, "This is what you want." And I went, No, I didn't want that. That's what I was trying to get away from."
Why would you want that?
Right.
So, Angelo, let me just back up for a quick second. So you're talking at this point in the narrative, you're in your 40s. So this happened. So you lived in pain for 20 years with this and just tried to maintain it?
But I did very well. I was very in shape. You had to stay, if your core is in good shape, your back is strong.
Right.
I mean, even if you had broken back, I mean, well, right now, I'm basically where we'll get to that.
All right, so the guy brings out a spine that's all caged up and fused up.
Together with a couple, metal pieces and screws, and I'm like, I don't want to do that. And he says, because it's L5 to S1, that's the part that moves the most. You got to have something big and strong for you, and nothing else is going to really work.
Right.
So I said, yeah, okay, and I didn't do it. And so about 3 months later, I decided to give the guy a call and ask him a question. And I actually got his number to where he scrubbed up before he went into the surgery. And I talked to him there. He was wondering how I got the number. I had a friend in his office.
Right.
Anyway, but turned out that I said, "Doc, if this was your back, would you get that operation?" And he said, "In a New York second."
Really?
And I said, "Thank you, Doc. That's all I need to know. I'm going to schedule." So I took his word for it, and I scheduled and got the surgery in 2001, May.
Okay.
It was great. I mean, the surgery worked wonderful for three years.
Right.
Until 2004.
What happened?
In 2004, something moved in my back, something popped.
Okay.
I don't know what it was, and I was in terrible pain, could hardly move.
What were you
literally.
doing at the time when it popped?
Oh, I was actually working on something. I was standing on a ladder.
Ooh.
And I was pushing on the roof. And I wasn't doing it hard. I mean, it was gutter helmet. I don't know if you ever know what that stuff is. You were putting it over top. I was putting it over top of my gutter.
Right.
It's quite not a physical thing. I mean, a little push, yeah. But I mean, how it happened, why it happened, I have no idea. But anyway, so after that happened, I got taken to the back to my doctor that did the fusion, and he said, "Oh," and he did me X-rays and this, and he said, "Oh, it's scar tissue."
Right.
And I said, "Scar tissue?" I said, "What do you mean scar tissue?" And he said, "Well, scar tissue will form in there and blah blah blah." And I said, "Well, you never," and it's very common and so forth. And I told him, "You never told me this before the surgery." I said, "You didn't tell me any of that. You told me I was going to have a strong, healthy back for the rest of my life." That's the exact words came out of your mouth, and it was.
And so
That's I didn't tell you.
This was just 3 years after your surgery that you had a recurring injury to something that was supposed to have been
I had
fixed.
pain. I didn't know what it was. I had no clue.
Right. Okay, well, listen, Angelo, we're up against a quick break, so just hang on. We'll get into the rest of your story, how you found Dr. Bonati, and get to where you are today. It's a pretty fantastic story. Kimberly, if people want to get in touch with the Bonati Spine Institute, how do they do so?
Well, they can reach out at 855-267-0483 or visit Bonati.com if you or someone you know is suffering from back pain. After the break, we're going to hear more from patient Angelo Sapia. When we return, you are listening to American Medicine Today on News Radio 970 WFLA. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years, and it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone, nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute. featuring the internationally acclaimed inventor of the Bonati Spine Procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thank you for joining us for American Medicine Today, brought to you by the Bonati Spine Institute. I'm Kimberly Brumell. Here with me, I have executive producer Ethan Euchre and world-renowned orthopedic surgeon Dr. Alfred Bonati. Before the break, we have patient Angelo Sapia still on the line from Pennsylvania. Apparently, when he was either 18 or 20 years old, he was working on a chair, and he accidentally stood up or caught the edge of an air conditioning system that was actually above him at the time.
It hurt me hearing that, because I can picture it happening.
Yeah,
I think we've
like
all
just
whacked
goosebumps and ouch.
Nasty.
But not only did he whack himself, cut himself, but he broke, I think, the facets. And they were saying it's in the area of like L5S1, really difficult area. He sought out some of the top doctors. They were talking about truly invasive procedures like cages, different things. And just to kind of ramp up, when he was, I believe, 45.
So he lived with this pain
for 20
some odd years.
Yes.
Yeah.
And then when he sought out another doctor, they were talking to him about implementing screws and plates into his back. So why don't you take it from there, Angelo?
Oh, okay. So let's see. So I had the operation, and then I had the problem, and I went back to the doctor, and he said it was scar tissue. So then he sent me off for treatments to get. I asked him, well, okay, scar tissue. So what do we do? And because evidently he didn't tell me about it, but now that I know, I need to know what do we do for to rectify the problem.
Correct.
And he said he's going to send me for some blocks, shots, like cortisone shots.
Correct.
Yeah. And I said, oh, okay. And it's great. And he said, yeah, he says, sometimes they take the pain away for a while. Sometimes some people take it away for good. Everybody's different, blah, blah, blah.
Which, Angelo, those, and Kimberly, correct me if I'm wrong, cortisone, and even Doc can maybe chime in, cortisone shots are not good for you, right? They're steroids. Aren't they bad for your liver and things like that? I know. I've heard about it in the animal world that it's not good for dogs to have cortisone shots. Can you elaborate on that, Doc, at all?
Prolonged use.
Yeah, we are animals.
No.
Well, I know that.
So anytime that they react something on animals, they react the same on us.
Yeah, so they're not good for you, and they're not a long-term solution to pain.
No, they decrease the strength of the ligaments. They create osteoporosis. They swell up, they retain fluid, they make your weight go up. One injection for corticosteroids will increase your weight around 5 pounds and will take around a year to lose it.
Holy cow.
And then affect other things. If you abuse that one, you can have some septic necrosis on the bones, preferably on the hip joints, or you can develop some cataracts. I mean, it's not something that you can use every day like a popcorn.
Right.
But isn't that kind of what they were doing to you, Angelo?
Well, no, they would give me a shot, and then they and he would. They really gave you no instruction. They would give you the shot, and he'd call you the next day and say, "How you good? How you doing?" And I'd say, "Oh, the pain is much better." And it would last. For the first one, lasted about a month.
Right.
I was pretty much pain free, and I was very happy. I was thinking this was my solution.
Right.
Well, after the month, pain came back. So I called them back, and they said, well, come and get another shot. I said, oh, okay, cool. So I went back and got another shot.
Right.
This time it lasted for about 4 weeks. Then I went back and got another shot when that ended, and that one lasted about 3 weeks.
So less and less time.
And then I went back for another shot, and they told me, oh, you can't have any more.
Right.
I said, what do you mean I can't have any more? They said, well, you're only allowed 3 a year.
Oh, wow.
And I said, excuse me? I said, what am I going to do for the next 9 months?
Right.
I mean, this is not an answer.
Unbelievable.
So I felt again, I lost again. So I couldn't get any more shots. So they said, well, how about to try lysis of adhesion? And this is a whole other process where they go up inside of you with saline solution and spray the scar tissue and supposedly break it up, because this is what everybody's believing, is that it's scar tissue.
Right.
Including myself. I mean, I don't know any better. I'm not a doctor. I'm taking the word of these world-renowned people, you know? It's like, okay. Needless to say, I don't take a lot of doctors' words anymore.
Correct. How did you end up finding Dr. Bonati?
Yeah, Angelo, how did you
That was just it.
Okay, there you go. So how did you find out about Dr. Bonati, and what led you to seek him out?
Okay. The truth is, I called the Laser Spine Institute because I happened to see the advertisement on a plane in a book.
Right.
Okay.
And I called them and I talked to them, and they told me all this stuff about what they could do. And they said, send us your X-rays and your MRIs. And I'm reaching for anything at this point. I'm
Correct.
in pain. I can't hardly move.
Right.
So I send it to them. And they call me back and say, yeah, they can help me. And all I got to do is give them $30,000 up front.
Oh, that's it?
And I said, excuse me?
Wow.
And she said, I said, how do you, I said, 30,000? I said, don't you just work with my insurance company? She says, no. She says, we'll take the 30,000 and then we'll work with the insurance company, and whatever we get back, we'll send you. And I said, so what does it end up costing me? She said, typically between $5,000 and $15,000. I said, that's my cost? I said, wow. I said, okay. Well, I mean, if that's all there is, I might just have to do it.
Right.
And I said, is there any other places that work with insurance? She says, well, there's a couple that I know of. She says, but you don't want to go there because they have a lot of failures and we have to take care of it. She said, I said, she said, especially at the Bonati Institute.
What a joke. And
I said, really? And I said, what's the other one? She says, well, I don't want to tell you. She said, I don't want to say anymore. And so the only thing I heard out of the whole conversation was Bonati Institute.
Right.
Stuck in your head.
So what happened?
Bad-mouthing them. And I know they work with insurance according to what she's saying. So, regardless of what she says, I'm going to give them a call.
Right.
So I did.
What happened?
And when I talked to them, they said, well, we need you to send us your X-rays and MRIs and all that. And I said, well, they're actually down the street at Laser Spine Institute.
Right.
And they said, well, when you get them back, then just send them to us. And that's what I did. And then after they checked everything, they called me back and said, yeah, well, Dr. Bonati says it was going to take 2 to 3 procedures, and it will cost you $1,000 per procedure.
Right.
And I said, really? I said, that's great. I said, how soon can I get in? And I scheduled that quick.
What was it like from the time that you actually stepped foot in the facility and then through the surgery?
Oh, it was an eye-opening experience. I mean, I'm very familiar with hospitals. I work in laboratories as my job, and I walked. I was impressed with everything. I mean, there wasn't anything I wasn't impressed with. Everything seemed to be a first-class operation, and people seemed to know what they're doing. They were caring. They were nice. I couldn't ask for anything better.
So tell us about the actual procedure, Angelo, and how.
Okay. So anyway, we started the. They scheduled me for the procedure. Well, first I come in, I do blood work and a bunch of stuff, and then I see Dr. Bonati, and he goes over the game plan of what we're going to do, which is like most surgeons don't even let you in on what they're going to do.
Right. Yeah.
He actually kind of explains it in layman terms so where I could understand it easily. And so basically we were going to take scar tissue out. That was what it was.
Okay.
And he said, well, where's your pain? And we started on the right side. And I said, well, I got pain in the front of the leg, the front of the thigh. He said, well, we'll go to L3. We'll go there. And so now I was awake for a lot of this.
Which you're supposed to be, by the way.
Oh, I know. But I mean, I was awake for a lot of this while it was just, to me, I had never, it's quite an experience. I mean, if you've never done that before, you're in for a surprise. It's kind of different.
Now, I'm told, Angelo, that near the end of the procedure, you were asked to do something that you didn't think you'd be able to do.
Oh yeah. Well, not just that. I believe he went and cleaned all the scar tissue from L3 down to the sacrum. In that during that procedure. I'm not 100% sure because I couldn't see. It was all done behind my back, so to speak. So. But and you keep watching a monitor while he's doing it. You basically watch the same monitor I believe he does.
Sure.
Angelo, let me ask you, at the very end, when they asked you to get up and walk around, did you think that was going to be possible following the procedure?
No, you don't. First off, you don't think it's possible to be awake while somebody's working on your back.
Exactly.
So you were able to get up and walk around immediately, still in the operating room.
You got to remember when I was wheelchaired into this in 2006. I was in really bad shape. I couldn't stand for more than 15, 20 seconds. I had to fly there by using wheelchairs on and off the planes by how the service they provide. I mean, it was bad.
Wow.
And when he did the right side, I was able to stand on my right foot for a day and a half or however long I needed to.
Wow, that's amazing.
I still couldn't do it on the left, though. The left was still sore. And turned out that on the next operation, he discovered he had to take the screw out because it was in the way. And so he took it out, and it was crooked. He had said it was kind of slanted or crooked, or in wrong or something like that. And he had taken it. He took it out, and when he started to take it out, I started kind of screaming. And he says, "What?" He says, "You should have no pain. There's no nerves in your bone," or something to that effect. That's what I kind of remember. I was pretty out of it. And I said, "I don't care. I still have pain." And he looked closer, and he found that the screw threads were evidently against the nerve. So I think he might have retracted something, and then he started to unscrew it, and then he says, "Do you feel the pain now?" And I said, "No." And he took it out. And looking back on it, it was comical, but trust me, it wasn't comical when it was happening.
Well, Angelo, we're almost out of time. Take us to right now. How are you feeling today? Are you good?
Well,
You
today
pain-free?
I actually went back, and I'm feeling okay. I'm feeling okay. I got a little pain this morning, but I mean, I've had 4 surgeries in the last 8 days, so you know, I expect to have some pain.
Sure.
And before I left, I didn't get I should have got a second. I had one shot before I left, and I should have probably got another one before I left, but I didn't. So that's probably why I'm really feeling the pain.
But you were back for something else than the previous surgery.
Absolutely.
Yes, just to clarify.
Well, actually, I was kind of back because of the fusion. The first fusion is what I'm told is after you have one fusion, the levels above or below will break apart again. And it's kind of like a vicious cycle, and you keep fusing that, and then you'll have the next level and so forth and so on. And if you do it this way, the way that I believe Dr. Bonati has done it, I don't believe that to happen again.
Well, Angelo, Dr. Bonati is here.
He's right there.
He is. He's right here if you want to say.
Dr. Bonati's right here if you'd like to say something to him, Angelo.
Hi, Doc.
Hey, Chief. What's going on with you now? What's that pain that you're talking about? What is the pain?
Surgery pain.
Oh, okay. Well, surgical pain. We don't do miracles. We just dig a little cuts there.
No, because they said they said maybe I should get another epidural before I left. And he says, because you might blow up or inflame or something. And I was like that. I had the pain, almost the exact same pain I had. And then once I sat down and rested and iced it down, it all went away.
Okay.
But I think it was because of all the travel.
Yeah, don't play football for the next 2 weeks.
All right. Well, Angelo, we appreciate you joining us on American Medicine Today, and stay in touch, and hopefully you will continue to live pain-free, my friend.
Oh, I hope so.
I'll give you a call in a couple of days just to be sure that this thing's going away and that you're okay.
Okay. Thanks, Doc.
All right. See you, Angelo.
Thanks so much, Doctor.
Thanks a lot, Angelo.
Thank you for being here, Angelo.
Have a great day.
No, my pleasure.
All right.
Well, you are listening to American Medicine Today on News Radio 970 WFLA. Coming up, we have medical expert Dr. James Pinkney of Diamond Physicians regarding how to curb youth sports injuries. We'll be back after the break. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine Procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
You're listening to American Medicine Today, presented by the Bonati Spine Institute. I'm Kimberly Brumell, here along with Ethan Euchre, our executive radio program producer, and world-renowned orthopedic surgeon, Dr. Alfred Bonati. Say hello to everyone.
Hello to everyone.
How you doing, Doc?
Well, on the line, we have Dr. James Pinkney. He's a medical expert of Diamond Physicians, and he's on to talk about youth sports injuries and what we can do to try to plan ahead so that we can curb those in the future. So welcome to this show, Dr. James.
Well, thanks for having me on.
Yeah, school's back in session.
Yes.
I know. Doc, did you play any sports when you were in high school growing up?
I did. I was a basketball player. Point guard, shooting guard, and I actually suffered a devastating knee injury when I was in school, so I can relate to youth sports injuries.
I bet.
Yeah, this survey came out, or a new study. It shows that 1 in 4 young athletes believe it's normal to commit hard fouls and play rough to, quote, send a message during a game. I'm actually surprised at how low that is. You know,
I thought it was high.
Really? You thought,
as a mom, you know.
Exactly. You're a mom.
I'm a girl.
You're also not, a man playing sports. But
correct.
I mean, I remember you would play hurt all the time just because, you didn't want to get benched. If you were a starter, you figure if you get hurt, you're going to lose your starting position to somebody else. And is that pretty common, Dr. James, of kids playing hurt?
No, yeah, that's exactly right. Our culture plays a large role in the rise of sports injuries. We're a win-first culture and a win at all costs.
Right.
So a lot of our adolescents are going to do what they can to win. They don't want to be benched. They don't want to let their teammates down, and they put their bodies not on the forefront, but on the back burner when it comes to playing hurt.
Right.
Yeah, and it also says here 54% say they have played injured. 70% of those kids say that they told a coach or parent that they were hurt. Top reasons given for playing injured, kind of as I mentioned, they said that it wasn't that bad. They couldn't let the team down, or they didn't want to be benched. And like I said, I mean, especially I watch a lot of mixed martial arts and things like that, and they always say the old adage is you're never 100%. That's just the nature of the beast, right, Dr. James?
That's very true, and from my own personal experience, when I was a teenager, the exact same thing happened to me. I had knee pain and overuse injuries, patellar tendonitis, and I was taking Advil way too frequently and playing through the pain, and it actually resulted in a career-ending knee fracture. That's something that's called a tibial plateau avulsion fracture. So it required major surgery. I still have 2 screws in my knee today, and it was because I wanted to play. I was a captain, and my team needed me to win. So, we have to change this culture, and we have to set up meetings before the season starts. And it's going to take coaches, parents, and these athletes coming together and setting ground rules so that we can prevent injuries during the season.
I found this statistic. 53% of coaches say they felt pressure from a parent and or a player to put the athlete back in the game once the child was injured. Why would we do something like that?
Again, it's a win-first culture. and parents, the athletes, they all want to play, and they want to win. And unfortunately, it's not, whether you win or lose, but it's how you play the game. Correct. And if our kids continue to play hurt and become injured, you can have long-term consequences.
Now, as a physician, Dr. James, what are some things that we can do short of keeping our kids out of sports, which, in my opinion, shouldn't even be an option? I think kids should play sports. Yes. In fact, I had a cousin growing up who, me and my brothers, we were into every sport. I mean, baseball, football, ran track, was on the wrestling team, just everything.
Tennis?
And then no tennis, no. I was going to say something really rude, but I won't. Tennis is a fine sport. Let's just say that. But
tennis is, it's like chess.
Yeah.
You strategically place the ball, and the people have to run around the court strategically.
It's not the manliest sport, I guess, is what I'm getting at. Oh. It's okay for women.
I love tennis, but
Thank you.
So let's take football for an example. We really, in order for us to prevent injuries, it has to start on the practice field, and we have to teach proper technique. One thing that I've noticed is we've lost tackling form. These kids are leading with their head. They're not looking at their target, and it's causing a lot of neck injuries and concussions. So we have to practice proper technique. Strength training is extremely important, especially if the child hasn't been playing a lot of sports over the summer. When you come back, you have to ease into your strength training program. Warm-up exercises, stretching, those things are critical to prevent injuries.
What didn't they used to talk about, like kids overheating and being exposed to the elements, and it was a little too much for their bodies to handle?
There were some kids that actually one died at football practice because a lot of you do two-a-days, especially in the summer when you're gearing up for the season. You're doing 2 practices, which really was not fun. But yeah, how much of a threat is overheating, Dr. James?
Heat exhaustion and heat stroke are major problems, especially with the two-a-days. We've actually had an increase in our baseline temperature of 2 degrees over the last 50 years, so it's hotter outside. We have more humidity, heat waves as well. When you combine heat and humidity, you're going to have a lot of sweat, you're going to lose a lot of electrolytes, and you're going to be at higher risk for heat stroke and heat exhaustion. So the most important thing with those 2 elements is to actually have a cold tub immersion bath on the field. And I think Georgia instituted a law, and every practice field, football practice field in Georgia, has to have a cold tub immersion so that if a kid gets overheated, they can lower that core temperature immediately, put them in the cold bath, and lower that core temperature so that they don't have a heat stroke.
Yeah, you know all about humidity. You're in Dallas, right, Dr. James?
Yeah, Dallas is actually a little bit drier. Houston, which I went to med school in Houston, is extremely humid.
Yes.
And the common misconception is that it has to be hot outside for someone to have a heat stroke or suffer from heat exhaustion. That's not true. We've actually had a kid die in 74-degree weather.
Oh, wow.
So it's extremely important to hydrate during practice, not practice during the hottest part of the day, and make sure you have some type of ice-cold immersion bath readily available in case somebody does overheat.
I actually want to back up for a quick second, Dr. James. You mentioned concussions. What are your thoughts on that? Because I know, the NFL Players Union, they sort of tried to organize. They had a lawsuit. Dan Marino was involved. I think he dropped out. I'm not really completely up to speed on where that is at. But what are your thoughts on concussions and sort of how it affects your brain as you age? Do you think there's a link between dementia and concussions when you're a kid playing sports?
Yeah, the studies have shown that multiple concussions do lead to brain damage, damage of neurons down the line. So I think our country as a whole is doing a great job with concussion awareness. Most schools have programs where they're testing our kids at baseline. They're doing a series of neurological tests, and if they have a head injury during a game, then we have a baseline. They do the same neurological test, and if there's any deviation from that baseline, these kids have to sit. They cannot go back in the game, and that is critical. When you have a concussion, your brain is more susceptible to swelling and even further damage if you have a subsequent concussion. So you have to give that brain time to heal, time for the swelling to go down, so that you don't have long-term effects, which include dementia.
Wow. It's just amazing to me. With that being said, going back to what I said before about parents or coaches throwing these kids back in once they know the child is injured.
Usually the kid, though, from a former player's perspective,
Right.
you don't even tell the coach. You know what I mean? You hobble off the field.
But how dangerous.
It's totally dangerous, but you're a kid, you know, and you just want to play, and you know, especially
So
if you have your father in the audience watching,
wanna
you don't want to disappoint him. You know, it's a whole lot of that.
Yeah, but you still want to be around.
The onus comes back on the coaches. It really, the coach, they have all the power. They have to know when a player isn't telling them the truth, when a player is truly hurt or truly injured and should not go back in the game. They have to take responsibility and put the player's best interest first and not winning.
Agreed. Almost out of time here, Dr. James, and I know we're going to try to get you on another time for this topic. I know you're going to like this, Dr. Bonati. Dr. James with Diamond Physicians, he was actually one of the first people in the country with his concierge medicine practice. He moved to a flat monthly membership fee because of hospital gouging. You find that interesting, Doc?
Very, very much.
We'll have you on in a future show to go ahead and expand upon that. But
Fantastic. It's a hot topic, and direct medicine and Diamond Physicians are the future of healthcare. So I would love to talk more about concierge and where the medical field is heading.
Okay, great.
Beautiful. Well, we appreciate you joining us, Dr. James Pinkney. Am I saying that right, Pinkney?
Oh, that's perfect. Like the color pink in a knee, Dr. James Pinkney. Everyone calls me Dr. James.
All right, diamondphysicians.com for more details. Of course, he's based out of Dallas, Texas. Appreciate you joining us. And like we said, we'll definitely have you on again and talk about concierge medicine.
All right.
Thanks,
Thank
Dr.
you guys so much
James.
for having me on.
Have a great day. Bye-bye.
You too.
Have a good one. He was also, that was the topic that we touched upon on the television show.
Yes, it was.
Which we're pleased to announce is now, it's been picked up by the Fox Business Network.
Yes, we are on every Sunday from 5:30 until 6 p.m. And then we're still on locally here on ABC WFTS 28.
It'll be on tonight, right?
Yes, it'll be on at 7:30 p.m.
7:30?
7:30 to 8. That's going to be the new time, 7:30 to 8, because there's games on the station. So we're going to be directly, I think,
Speaking of
following
sports.
the news. And yeah.
No tennis, though, I hope, right?
I like tennis. What is with you in tennis?
Doc, it was really funny. We were talking about athletes yesterday at the office, and the only name, we were talking about golfers, actually, and Kimberly starts naming tennis players, and I'm like, we're not even talking about tennis.
Only tennis
we're talking
players.
About the only athletes she knew were tennis players. What's up with that?
No. I knew Tiger, and I knew Nicklaus. And
that's about it.
That's pretty much where it ended. I'm sorry. I don't mind playing golf, but actually watching. Sorry.
It is a bit of a snooze fest. Well, if people want to get in touch with the Bonati Spine Institute, Kimberly, how do they do so?
They can reach out at 855-267-0483 or visit bonati.com. Coming up after the break, we are going to hear what's new in American medicine today. You're listening on News Radio 970 WFLA. We'll catch you on the flip side of the break.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine Procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thanks for listening to American Medicine Today, brought to you by the Bonati Spine Institute. I'm Kimberly Brumell, here with world-renowned orthopedic surgeon Dr. Alfred Bonati and our friend and executive producer, Ethan Euchre. Well, Dr. Bonati, I know you're wound up and you want to talk a little bit more about illegals and immigration and healthcare, and we're going to find out up next.
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
Dr. Bonati, it's all you.
Well, the Obama administration and the immigration policy is another horrendous attack to medicine.
All right.
People don't understand the circumstances of these people coming to this country without really being properly selected or study or check what type of a health they bring over. Well, in 2003 to 2011, the program of that they reviewed children that they came to this country without company. There were around 6,000 to 8,000 children.
Okay.
We're talking about 3 to 11. Last in this year, 90,000 crossed the border.
Right.
And they're calculating that in 2015 is going to be around 127,000. So the problem is the irresponsibility. I'm not going to be tired to talk about these blasted politicians. They only think how they're going to get votes to remain on their position. They don't care about the health of the people. They don't care about the poor. They don't care about the women. They don't care. They don't care about anything. They get in those fragments of discussion in society with the only interest to lock votes. And the people are so blind and so ignorant that they react to that. So anytime that the politician's talking about something, you need to look why. And when you look why, you're going to find that the only thing he's looking is to continue his lavish life and his behavior to get better economically.
Well, and most of them are so out of touch with what the average citizen actually thinks and feels that, you know, they kind of just do whatever they want unless there's a backlash from the citizens, and then, oh, I guess I did the wrong thing, and then they try to fix it.
Well, maybe that part of the statement is true, but the reality, these people are corrupted people. They're people that the only thing that they look is how they're going to benefit themselves. Unless we put term limits, we're not going to correct that. And I keep talking about this thing, and I hope that people's listening, and very soon we'll start to get some signatures so we can really work in this situation and don't talk anymore. But imagine the damage
of individuals that they cross the borders. They are, first than anything, we have situations like tuberculosis that is not anymore responsible. They don't respond anymore to the actual medications that we use to correct tuberculosis. They are resistant. They're resistant tuberculosis patients. Now, if you allow these people to come over, we will have an enormous amount of outbreak that is not under control. They are already seeing cases in Texas of this type of outbreak. Now, how about diseases like measles, like influenza, like outbreaks of these diseases that they are not going to really happen immediately, but that suddenly is going to be a tremendous amount of spread in the country. And the worst part of it, these people, by the Democrats, that they are allowing this thing to happen, they are then shifting these people to different regions in the country. So they are sending people from the borders all the way down to New York. So
The
suddenly
outbreak is going to be throughout the U.S.
Exactly. So they are going to spread. What Obama is doing, the man is a traitor. Is selling the country so he can stay on his position. The worst part of it is affecting the medical control, the control for prevention of diseases in this country is totally busted because they're allowing these people to come over without being stopped on the border and check if it is somebody who needs to be treated, it is somebody who needs to be properly, or who needs to be returned to this country. Right. Now, if we don't do that, then the next thing that happens, the outbreak is going to happen here. And the governors of these other countries are saying, it's not our problem, it's your problem.
Right, because Obama is allowing it to become our problem.
Exactly.
You know, it's unfortunate that
he wants the votes.
Right.
The Democrats want the votes. So Obama wants the votes.
I think one way to get over it is when they ship them here illegally, then I think instead of busing them up and driving them to any other part of the country, you set them right in front of the White House. You say they're not going anywhere.
Give them a tent.
And say, this is Obama's direct problem. Don't disperse them amongst the states.
But to do that,
then you ship them back.
Yeah, but you need to do something like that.
And the country that they came from needs to pay for them instead of our tax dollars going for that. I'm all about trying to help people, but you know what? It's making our economy and everything worse.
Well, a lot of it too, Doc, is that,
and it's endangering us.
And you guys have probably heard about this, where there's human traffickers that's how they make their living. Is they take money from these people and say, hey, we'll escort you to America. Everything will be cool. They'll let you in, and they're pretty much right. You know, we're not stopping the influx of these people.
Yeah, but I understand that the problem here is the chronic diseases that they can come over here can get an outbreak that is going to break the economy of the medical system, and we don't have doctors properly trained for attack this disease. We don't have the experience because we don't have this disease in this country. So before we recognize it's going to be an outbreak. And then before we train how to train these things, it's going to be a lot of people infected. And no, this is not a joke. This is something that the normal citizen should react and start to participate and say it's not going to happen.
And that's a look at what's new in medicine today with Alfred Bonati, MD.
Good stuff as always, Dr. Bonati.
Wow. Well, I don't even know what to say. I'm flabbergasted only because there's so many things that are just corrupt and inept with this administration, and it's everything from immigration to health care, everything.
Next thing you know, we're going to see Ebola over here. That'll be the next thing.
Well, we already have the couple of people that came back.
That's true. That's true. That'll be next.
So you never know.
That'll do it.
Well, if you or someone you know is suffering from back, neck, or sciatic pain, reach out to the Bonati Spine Institute at 855-267-0483 or visit Bonati.com. You're listening to American Medicine Today on News Radio 970 WFLA. Make sure you tune in this evening to WFTS ABC 28. 7:30 to 8 p.m. will be on, and Sundays now from 5:30 to 6 on Fox Business. See you next week.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.